Welcome to the COVID Corner. My name is Rosina Rai and today we have very special guest invited. Dr. Mani Dixit is a research scientist and a public health professional in the field of Nepal's public health. He has been contributing for the past 13 years in public health. Since the breakout began, Dr. Dixit has been appealing people to maintain safety protocol through media and interview, and he has been consistently spreading positive message to help people stay safe. Welcome, Dr. Mani Dixit.
Thank you very much, Rosina, and thank you for having me on the show.
Very first question we all do have is that how is the second wave different from the first one? Everybody have this question.
Okay, so let's begin in a very short way by saying that the coronavirus that we are seeing right now is just one of the many variants or many different mutations of coronavirus floating in the world. So in Nepal, we appear to have 2 or 3 different variants, and every time a variant comes about, it comes with few new characteristics. Not necessarily very dangerous ones or very different ones, but few minor adjustments. So the one that seems to be floating around in Nepal at the moment appears to be very infective. What that means is it's able to spread or transmit between people much faster and much easier than its predecessor, the so-called the wild type. So that is the major difference. Other than that, there's some testing differences and there's some genetic differences, obviously. But the major difference, as far as we are concerned from public health, is that it can transmit between people very fast.
And Dr. Dixit, can you make this clear? How does it transmit and spread, and what is its fatality rate currently?
Okay, so the case fatality rate, the CFR for the original virus that started from Wuhan has differed between different countries and also differed during different times. I mean, it started at some point in Europe and America as high as 6%, so 6 in 100. Then it has gone down in Europe and America to lower than 1. In South Asia, where Nepal is situated, it went up to 1% in different countries, including India, and it has stayed around that, so around 1%. So, and in some other countries in Latin America, it has been about 2–3%. So, to make it very summary, if you were to average it out, if you look at the global average, today in today's context, not focusing on different population differences, it seems to be around 1% CFR for those infected with the virus.
All right. Normally, we have this knowledge and idea of physical distancing and wearing mask and using hand sanitizer and washing hands time and again. It is said to be, very effective measures to be prevent contraction of the disease. So how do they actually really help in this second wave?
Absolutely, absolutely. We must remember that this is coronavirus. When it first came about, people did not know how it was transmitting between people. Some thought, oh, it just floats in the air, it's fully airborne. Some thought, oh, it spreads through the surface.
Yes.
Some people thought, no, it's not. It's through the aerosols or particles that we spit out, in our saliva. So as the time has gone through, we know for sure it spreads mostly due to aerosols, which means it comes out from our nose and our mouth, and usually with our saliva particles, not by itself, but with saliva particles. So that, because now we know that it spreads like that, the way to stop transmission is to prevent aerosols from our mouth and our nose to go out to somebody else in a very close distance. So for that, we wear a mask, we keep a distance like we are doing right now, a distance of at least 2 meters, if not more, and wherever the distance is not possible, you wear a mask. In the best case scenario, you do distance and wear a mask, both. So these measures have been found to be very effective, and especially in a very close contact, masks have been found to be extremely useful. And on top of that, if you're outside in open air, the chance of transmission between 2 people at a distance of 2 meters is close to 0%. So that way, all these mechanisms in place make sense. And yes, and keeping your hands clean, having a mask on, keeping distance are very useful and very proven way of stopping infection between people.
All right, Dr. Dixit. You know, people talk about this wearing masks topic. Many of the people say that wearing masks is actually causing another disease that is lung related with lungs. In the future, we are going to have lungs related diseases, will not be able to, you know, breathe properly. So this kind of, you know, talks happens among the people. Even talking about me, wearing masks feels so suffocated. I feel so dizziness. So what is the opinion or your knowledge or idea you want to express on that topic?
Okay, so
many people do have
and
that.
I understand and I agree that a lot of people feel that way. So, but then again, we always have to focus on the science. Just because you feel something, I feel something is not science. When thousands and thousands of people feel the same way, then it becomes science, right? So the science says that wearing masks for a long period of time, like a surgical mask or even N95, does not have detrimental effect on your health. It does not really badly affect your breathing or your lungs, because people have been known to do surgery in a normal situation, not just COVID, wearing masks for 4 or 5 hours, and obviously we don't see surgeons falling down and fainting. So literature does not provide any evidence that wearing masks for a long time will give you a very long-term bad effect. And also, if you don't wear a mask and you get sick, the chances of you having a bad lung due to COVID is much worse or much bigger than you being sick due to wearing masks. So I would always say, wear a mask. If possible, get some fresh air in between when you are by yourself, not when you're in front of people. But do make it a point to grab some fresh air every now and then. But other than that, don't worry. Wearing a mask is far better than not wearing one, especially in a situation of COVID.
Thank you so much. I myself is very clear, and right now I'm thinking that I think I have grasped very wrong information.
Yes.
Wearing mask is, you know, causing another reason. So another question I want to put forward is that yes, we have witnessed this. Physical distancing is to be the most challenging protocol to maintain. Can a person be safe by following other two protocols?
Of course. So, I mean, what we know from evidence in the literature, in the scientific literature, is that distancing is a major contributor to transmission. So, lack of distancing is a major contributor to transmission, especially when you're in a closed environment without a mask. But if you wear a mask, all of a sudden, if you have distancing, obviously, transmission does not happen. So, yes, as far as distance is concerned, it is very important to maintain distance. In terms of the mask or distance?
What I was about to ask is that, what words you want to convey being a doctor and this long experience? There are a group of people who are being ignorant about wearing masks.
Right. So let's put it, so because I'm a scientist working in public health, and I also deal with infected people when they come for testing and for research purposes. It's very important and to realize that masks save lives. And I was talking to some other people, even outside, not in this interview, but outside. They're saying, well, it's not always possible to maintain distance. So suppose you're you're outside, being shopping, even buying vegetables, or you're walking. Sometimes you're going morning walk. You might suddenly come across someone right? It could be in a bus, public transport.
Yes.
So the distancing is always not possible. You'd like to do that, but it may not be always possible. But the prevention is the mask. Even when distancing is next to impossible, as much as you try, one thing that you can control, distancing is something you may not be able to control, but one thing you can control is the mask. Mask is something you have in your hand, I have it here with me, I can always wear it. I can choose to wear it. And that will save me from being infected even in very close contact settings. Obviously, when you wear that, don't take it off. But then having a mask is a major deterrent to the virus, and it will prevent you from being infected and you transmitting to other people.
In the context of this rising situation, almost people, they are trying their best to follow or maintain the protocols. Beside that, what else can help people to be safe from this virus?
So look, one of the things we always say, don't put yourself in settings where the infection rate is high. Now, right now, for example, Kathmandu, Baake, Rupandei, Porsa, these are risk areas. So as much as possible, don't be in those places, if possible, right? So if you are now somewhere in Jumla, don't come to Kathmandu, for example, right? So that is the first. Don't be in a setting where the infection rate is high. But if you cannot do that, make sure you are distanced from people, you maintain your mask, that's what we were discussing, and try not to go to places which is heavily crowded. Now, the government will soon probably bring out some measures to control the pandemic in Nepal, and then it might say, well, they'll have a very short time to open the shops. In those times, there might be a rush to buy vegetables, or rush to buy other products. And if you go when the rush is very high, you may even get infected in that time. So minimize those times, right? So, and when you do go, make sure you have your hands are clean, you have sanitized yourself, and then all the measures I've told you. And also, most importantly, we have a vaccine now. We have a couple of vaccines. If you get the opportunity, wear those vaccines. Get those vaccines. Do not question the vaccines. Do not say, oh, which is better, which one should I get? No. The vaccine you have access to is the best vaccine. Bottom line, the vaccine that you have access to is the best vaccine. So get the vaccinated, get both doses, have some people loved dear ones and near ones to also get vaccinated. So these are the things I would recommend that every one of us does to get not get infected and be safe from COVID-19.
Yes, Dr. Samir Mani Dixit. I think in this point, people have actually reached in the point they have got exhausted, right? They feels like there is no possibility of breaking this chain, this virus chain. So what do you think, is there any available measures or other options to break this chain of current spread rate?
Best one is vaccination. If everyone or at least 70% of the population is vaccinated, then the chain will never happen, because people will protect themselves, because the immune system is going to fight the virus. The virus has nowhere to go. It will die out, right? But then we're nothing close to that. In fact, most of the world is not close to that. And then to break the chain, we have two options. One, we wear a mask, distance ourselves from large gatherings. If each of us does that, then the chain will be broken automatically. For example, if you don't go to where there are a lot of people, if there are more than 5 people and you don't join that crowd, and if you wear a mask and distance yourself even when you do have to join that crowd, you will not get infected. That's one less people that's going to get infected. In a country with 30 million people, if every one of us does that, the virus has nowhere else to go. So whoever is infected will kill the virus themselves, and then that's the end of the outbreak or the pandemic. Now, if that is not possible, then the third and the worst option is the lockdown.
I'll come to that point.
So the lockdown is when the government doesn't believe that the people will do what it tells them to do, and the distancing, masks, and gathering is not followed. The government will say, well, then we'll make you. You didn't do it yourself, so we'll make you do it. That's when the lockdown, the argument of lockdown and the implementation of lockdown
Relating
happens.
this explanation, yes, again there is two crowd of people. One says that lockdown and this prohibitory is not a last option, okay, not ultimate option to break this chain. So what do you think, is this lockdown or prohibitory is actually the best available option to break the chain? One is against of that, there should not be lockdown or prohibitory.
I don't believe so. I mean, if you ask me personally whether I believe in lockdown, no, I don't. And the reason I don't is because I believe in the first option. You make sure that every individual masks up, wears a mask, and distance themselves from infected areas, and keeps their hands clean and keeps the distance. I believe that if the state or the government ensures that this happens, if the government puts strict measures, including fines and even jail terms, to people who do not wear masks and do not distance, then this is achievable without having to lock down. But unfortunately, as much as I might hate it, and as much as I don't believe that lockdown is the solution, when you can do the other two, which is vaccine and the mask and distancing, then you are left with no other option but the lockdown. So that's why the government always finds it easier to go for lockdown, because vaccine is difficult due to various reasons, as we have already found out, and also having people wear masks and distance themselves is also getting hard because the political leaders themselves are not doing it. So the government has to go to the third plan, which is worse. In fact, it's bad for all the population, except for the hospitals and the clinicians. Overall, it's bad for everyone else, but unfortunately, that looks like the way you have to go in absence of implementing the other two options.
So what do you think, who is responsible for this massive spread this time?
It is the people. Absolutely. You cannot blame the government for people not wearing a mask or not holding rallies, going to heavily crowded areas, having parties, having nightclubs open and discos. You can't blame the government. It's like this. The government can do something. Yes, you can blame the government for not enforcing the rules. But remember, we are in a democracy. In democracy, it's very hard to enforce everything. Same happened in India. The same didn't happen in China, because it's not a democracy and people are under a strict rule of the government, and government can enforce itself. But in a democracy, enforcement is always going to be difficult. So the people did not do what they're supposed to do. They could have worn masks. They didn't have to, the youth especially. They didn't go around, They went around, partying and not wearing masks, not distancing themselves, but they were silent carriers. Some of them were even super spreaders. So the blame lies on the population. There's no doubt about that. But I would say 70-30. 70% is the blame on the people. 30% is on the government, because government could have A, implemented it strictly, B, advised other measures, and C, brought vaccines. The government is under pressure, I know, for the vaccines also, but government could have tried different diplomatic channels to try to at least vaccinate, let's say, 20 to 30% of the population that could die from the disease. But once they were vaccinated, then the rest of the population, if they're infected, does not matter. They'll survive. But the government could not even do that much. So therefore, 30% blame goes to government, but 70% goes to the people.
Dr. Dixit, keeping this situation, this present especially going on situation, keeping into your mind, what suggestion you actually want to put forward to contain the spread?
No, I would suggest the same thing I've been saying earlier, It's up to us. So there are two things that's going to happen. Forget the vaccine. Vaccine is something beyond our government and beyond our people. It's the global politics at play. So there's not much our government can do or we can do. That's the first one. Second is something we can do, which is wear a mask, distance. And third is the one that government can do. So we go from global to individual to the government. So which is easier? The one we can do. We're 30 million people. There's only one government. Which is bigger, 30 million or one? So if 30 million people wear the masks, distance themselves, government doesn't need to do that one thing of lockdown. So the choice is very clear. So let's wear masks, let's distance ourselves, let's try not to go where there's a lot of people, in Nepali bhidbad. So let's not do political rallies, let's not hold any kind of social event, let's not do private events for a few months. So that's what I would suggest.
Is the proposed prohibitory order by the government timely, or it is too late? What do you think?
I would say it's a bit too late. But then, in a pandemic like this, it's never too late to start. They could have, I'm not going to say prohibitory order. I'm saying the action by the government is okay. They could have really enforced the masks and the distancing a month ago. Under the Nepal-India border, they could have monitored a bit better 2 months ago. So those were the things government could have done earlier. But then, having said that, since we are still in the very early stages of the second wave, government has come up with some key steps, not to support the lockdown. The other steps the government has started, so I would support that. But I also would say that, you know, if at all possible, do not go for lockdown. Just stay with distancing and masks.
Thank you so much, Dr. Samir Mani Dixit. You have been playing a vital role, especially in this time, pandemic time, and obviously we really do hope that positive message is going outside through this conversation. Concluding this conversation today, stay healthy, take care of yourself, wear mask. Thank you so much.